One of the important factors for easy and smooth defecation without increasing too much intra-abdominal pressure inside of the belly is the angle between the rectum and anal channel. If become more wider, is easier to defecate and poop. So the position that is good for our purpose for defecation is squatting. In squatting, we have a lot of ligament and muscle that finally straight the angle between the anus and rectum. So in this position is very healthy compared to the sitting position. Especially this position is recommended in those people that have high risk for varicosis, that is dilatation of the vein in the legs, because especially in those patients with have family history of varicosis, because in this position those vein is closed and doesn't press too much, pressure doesn't apply to the vein and those valve that is inside of the vein in the leg. That is good position for those people. And those people that they have hernia or they have some venous, especially in the brain malformation, because in this position we use the minimum strain and bear down. In that case, our pressure inside of the chest and abdomen and brain during defecation doesn't increase too much. So the final point is that if we have access, the old-fashioned toilet is better. But if we don't have access to that, or we have some joint or back problem, we cannot squat. In that case, we have is better we use a squatty potty or whatever you called it. Sometimes they called it stool, toilet stool, or whatever it called. Most market they have it, big market. When you use this one, as much as possible, make it the stool close to the toilet, that the angle between the belly and thighs decrease. So in some way, as much as possible, if you can. So the tight press the abdomen. It helps during strain. And another important parameter is that we shouldn't strain and push too much until we feel some movement in our rectum and we can feel it start coming out. In that case, we close our mouth and gloat and bear down gently, not too much strong. Up to the next time.